Now, what does low sodium or hyponatremia mean, or how does it occur, or what could be the symptoms? Now, low sodium or hyponatremia is a very common terminology. It is very commonly seen mostly in elderly patients or those patients who have high blood pressure. So, those patients who have high blood pressure are very commonly prescribed antihypertensive, in which there is one class which is called diuretic. So in diuretic, very commonly, one of the most commonly used medicines are Lasix or furosemide, Ditor or torsemide, metalazone, aldactone. So these medicines are very commonly used to reduce the burden of the salt or burden of sodium in the body, because one of the most common pathology for high blood pressure is high sodium level. So to reduce that high blood pressure, to reduce the high salt load, we give these medicines so that the sodium can be flushed, the high sodium can be flushed, it should come to a normal range and the blood pressure should come to a normal state. But very commonly, these patients keep on taking the same medicines, they restrict their salt intake to a very high extent levels, so that the sodium then falls to less than normal level, and that when hyponatremia occurs. Very commonly in elderly patients who have high blood pressure or who may not have high blood pressure, they many of the times are very malnourished, their diet is significantly lesser, especially they restrict their salt intake to a significant level, and that could also cause a nutritional hyponatremia or nutritional low sodium level. So normal level is around 135 to 145 milliequivalents. Whenever it falls to less than 120, it is one of the emergency, and such patients can very rapidly deteriorate. Such patients can land up in coma. Such patients can have convulsions. Such patients may have altered sensorium. Such patients usually tend to sleep. They may get awake when you call them, when you tap them, when you pat them, but usually they tend to sleep again. So altered sensorium, tendency to sleep, feeling sleepiness, feeling very low can be definitely a symptom of hyponatremia. Many of the times when such patients try to walk, they may be very much dizzy, they may be very much ataxic, they may have a tendency to fall on any side, like they are like dizzy like this. So generalized weakness, tiredness, sleepiness, dizziness while walking can definitely be hyponatremia, and such patients may get convulsions also. So those patients who have high blood pressure or elderly, those patients especially who are taking this hydrochlorothiazide, chlorthalidone, Lasix or furosemide, Ditor or torsemide, they should keep on repeating these levels of electrolytes in the blood at a regular interval, so that the sodium should be in the normal range. It should not be less than normal. If it is less than normal, then maybe temporarily the blood pressure medicine of this class, the diuretic class, we may need to stop them for a temporary period. That may totally depend on patient and his condition. So these are the causes, these are the symptoms, and the treatment most of the time is replacement of the sodium. That can be by saline infusion or by 3% NaCl infusion. That is done once the patient is admitted, and withholding the culprit medicine for a temporary period and restarting it if it is needed, if it is mandatory, or it may be completely replaced by some other antihypertensive medicine if it is needed to control the blood pressure. Thank you.